Good day. Welcome to Conversations with AARP in the Virgin Islands. I'm Troy Deshabert Schuster, State Director of AARP in this territory. And once again, it's a pleasure to be with you today to bring you important information that affects your life. And today we are going to continue our conversation about COVID 19. And so we have with us a very special guest. We have with us Dr. Esther Ellis, who is the territorial epidemiologist for the Virgin Islands, working within the Department of Health. Good day, Dr. Ellis. How are you?
Hey, I'm good. How are you?
I'm doing very well, thanks. And thank you for taking time out of your busy schedule as you're working diligently to keep us safe, to keep us healthy,
Of
and
course.
keep us
My
involved.
pleasure. My pleasure, really. Thank you for having me.
Yes, thank you. And so tell us a little bit first about your profession, about what it means to be an epidemiologist, the education leading up to that, and what do you do as an epidemiologist?
Right. I mean, that's a great question. And it's kind of pre-COVID. Most people hadn't really heard of epidemiologists. It feels like COVID has really highlighted a lot of what we do. But epidemiology is a branch of science that deals with control and prevention of communicable diseases. And so the prevention is a huge part of what we do. And so if you don't see it, you don't hear from me, things are good. But there's still a lot that we're doing in the background to prevent communicable diseases within the community. So we investigate diseases. I keep track of 88 reportable diseases within the territory, and in a historical database, online database, to see if anything comes above baseline, and if it does come above baseline, why? And are all of these people living in a particular area, or is there some sort of exposure commonality? If it's a foodborne illness, did they all eat at the same restaurant? And we provide a lot of education as well for new diseases. So within the territory, when we had Zika come here, chikungunya, leptospirosis, we provided a lot of education to the providers in the community as far as what are the signs and symptoms, what do you do if you get sick, etc.
88 trackable diseases here in the Virgin Islands. That's a lot of
Yeah,
possibilities, right? That
right.
was kind of scary, and it's a very important role you play in tracking that again, so that we can know how to treat and how to avoid those diseases. So now, talking about the education leading up to being an epidemiologist, what kind of education makes you into an epidemiologist? If somebody's interested in becoming one.
Yeah, well, my dad is actually a science teacher, and so I was always really interested as a kid in science, and we did a lot of science things together. And I went undergrad. My undergraduate degree was in microbiology. It was pre-med as well, pre-med track. So you take all of the chemistry, organic chemistry, microbiology, all of the core science courses you need. And then my graduate degree, it's a PhD in tropical medicine from the John A. Burns School of Medicine in Hawaii. After that, I did a 2-year fellowship post-grad in Singapore within the emerging infectious disease unit, where I helped set up testing and surveillance for emerging infectious diseases in Southeast Asia, because Singapore really is a hub for emerging infectious diseases in Southeast Asia. And then I did a 2-year fellowship with the Centers for Disease Control. It's called the Epidemic Intelligence Service Fellowship. And it's for MDs and PhDs. They also take a couple of vets, veterinarian doctors, and one nurse every year through this program. And they train you really in disease detective work and how to identify an outbreak and then quickly respond to it internationally. So during that fellowship, I worked in Africa, Haiti, Puerto Rico. I actually came to the Virgin Islands to help respond to a dengue outbreak during that fellowship as well.
Right,
Ended
right.
up here, and I've been here ever since.
Well, that's an incredible background of education that you have, and we're so honored to have you here in the Virgin Islands because you bring along with you just a world of training and experience, and it's so needed here. Is there another epidemiologist here, or are you the only one for the Virgin Islands?
So I'm the chief epidemiologist, and it's either in a state it's a state epidemiologist or territorial epidemiologist. And within the division now, we have hired a lot more staff. We have about 20 within our division now. Other epidemiologists, contact tracers, surveillance officers. The administration that's required to run the division. So we have a staff of 20 now.
Excellent, excellent. And now we're here today to talk about this COVID-19. Looking at COVID-19 and its progression from being what we at first thought was an epidemic to a pandemic. If you will use COVID-19 as an example, a real life example, to explain to our audience the difference between an epidemic and a pandemic.
Right. So an epidemic would be something that's occurring in limited geography locations and limited locations. A pandemic is when it's a worldwide problem. And the control just with COVID specifically wasn't possible. So when it first started in Wuhan, China, initially it was considered an epidemic. And then once it was internationally an issue in Italy and various countries, it was a pandemic. And so that was back in December when we really started looking at COVID in the U.S. Virgin Islands and knowing that this was a concern. It was going to come here. The question was not if, but when. And so by the end of January, the WHO, which is the World Health Organization, had declared an international emergency. And by the next day, HHS also declared a national emergency for the US. And in the Virgin Islands, we didn't have our first case until March 13th, but we started testing samples in late January for COVID.
And when did COVID first turn up here? When did you first detect it here in the Virgin Islands?
Our first confirmed case was March 13th.
March 13th. Okay.
Of 2020. So almost exactly a year ago. A year, yeah.
Wow. Yes. I remember a year ago too well. And then in early January, my partner and I were in Brazil and we were hearing all these news reports and thinking, we need to get back home. We didn't know what was going to happen. So those are moments I'll never forget. And here we are a year after it hit the Virgin Islands. And thankfully, we're doing fairly okay here in this territory, thanks to your work and the work of your team and the Department of Health and our Commissioner of Health and our Governor, who have all worked so very hard to keep us safe. So again, thank you for bringing us this far.
My pleasure. My pleasure. So as the U.S. Virgin Islands, we've done incredible in this response. If you look at access to testing, we have free access to testing multiple times throughout the week at pop-up testing sites. We're still one of very few locations where you can get tested and get your result the same day. And I know a lot of Virgin Islanders that have traveled off island, you have to have a negative test result to travel back home. It's hard. You need to pretty much schedule that before you even go. Get tested, right when you get somewhere so that you can get your result back in time to travel home. And so from testing to now the availability of vaccines, I can't believe we had availability to a safe and effective vaccine at the end of December. So not even a year after our first confirmed case, we've been able to focus on vaccinating individuals. It's been a very successful response and collaborative response with the Department of Health, immunization, epidemiology, communicable disease division. There's so many within the Department of Health, but then also other federal agencies that we've worked with, and most recently on the vaccine efforts, FITEMA, which is the Virgin Islands Territorial Emergency Management Agency.
Fantastic, fantastic. And looking back at the Spanish flu, approximately 100 years ago, that was, if I'm correct, the last major pandemic before COVID-19 of great significance. How do the statistics that we're seeing now from COVID-19 compare to the statistics from the Spanish flu? Are we seeing more people dying now, or is it less people? What was the death rate? What is the death rate of COVID-19 compared to the Spanish flu, et cetera? Can you share some of that with us?
Yeah, so it is really hard to compare them for a couple of reasons because the Spanish flu was in 1918, and the way that data was tracked and the way communication was done, how fast you were able to communicate with people, makes the way the data was collected a little bit differently. So it's hard to compare to now because the way we collect data is much more accurate. We're probably catching more cases and more deaths because we do have more access to healthcare, hospitalizations, to identifying if deaths were due to COVID-19. But with the data that we have, the death rate for COVID-19 is worse than the 1918 flu pandemic. And for the Virgin Islands, we've done really well. We actually have the lowest death rate compared to everywhere in the U.S. And territorial, except for the Northern Mariana Islands. We also have access to monoclonal antibody treatment, which has been incredibly successful at preventing severe disease. So if you become positive for COVID, epidemiology reaches out to you and we ask you a series of questions as part of our contact tracing efforts. In addition to determining who you've been with or who you may have exposed, we also find out if you qualify for monoclonal antibody treatment. Anyone over 65 does automatically. Otherwise, there's underlying health conditions that would qualify someone for the treatment. And it's been 100% successful in the Virgin Islands for everyone that's received it at preventing hospitalization. So far, everyone that's received the monoclonal antibody treatment has not needed hospitalization. We do have a handful of hospitalizations within the territory right now for COVID. It's not a treatment you can use once you become hospitalized. So it's an early treatment for preventing hospitalization.
Okay. Now, monoclonal antibody treatment. That's a big term. Can you break that down into layman's terms and explain that to us? What is that?
Right. So basically, what was done is some of the first COVID samples, blood samples that we had, and not here in the territory, but within the U.S. were taken, and the blood samples were used to make an antibody, a monoclonal antibody, which is an antibody that mimics your own antibody response, but it helps boost your antibody response. So if you get this antibody treatment, it boosts your antibody response and your own body's immune system's ability to respond better to the virus.
Okay. So I'm not sure that I completely understood that.
Okay.
Let's go a little bit deeper into that. So is this produced then from blood of donors, or is it from the blood of the recipient of the treatment?
So
How does
it's
it?
actually the way it is now, it's not a blood sample that you're getting from someone else. So it was what it was is it was antibodies that were identified in blood samples taken from some of the first patients that recovered from COVID-19 in the United States. And then those were used to make a drug. So it's an actual chemical mimic of these antibodies. And so there's 3 monoclonal antibody treatments, and it's and they're really, what they do is they block the ability of the virus to enter your cells and make you more sick, if that makes sense.
Yes.
Okay.
Yes. Okay. So it diminishes or cuts down on the replication of the virus.
Correct.
Therefore, you have less of the virus to deal with, and you develop your own antibodies faster, and you're dealing with it better,
Right.
basically.
Exactly. And
Okay.
it's been, I guess the important take home is it's been 100% successful at preventing severe disease, especially in some of our vulnerable populations, like the elderly or anyone that's high risk. So besides the elderly, you can also qualify if you have chronic kidney disease, are obese, have diabetes, are have immunosuppressive disease, if you're currently receiving any immunosuppressive treatment. Obviously, 65 and older, as I said. If you're 55 and older but have cardiovascular disease or respiratory disease, and then 12 to 17 if you have heart, lung, or a neurological condition, are obese or overweight.
Okay. Okay, great, great, great. Well, I'm so glad that we have that treatment here in the Virgin Islands. That'll really help a lot of people, I'm sure, for those who may be in need of it. The Now looking at the vaccines, we have the two most popular vaccines available here: the Pfizer, the Moderna.
Mhm.
Uh, do you have data on the number of Virgin Islanders who have received the vaccines to date?
Yeah, I do. Let me pull that up for you. So, also, starting March 1st, we actually opened up Department of Health community vaccination centers.
Yes.
So, as of yesterday, we vaccinated, administered a total of 29,911 vaccines. Um, since March 1st, at our CVCs alone, 5,082 of those vaccines were at our CVCs. So we've really increased the throughput of being able to get people that want the vaccine into an appointment. 20,701 of those are first doses, and 9,210 are second doses. We are on track to hit our goal of 50,000 first doses by July 1st.
That's fantastic. Yeah, you might hit it before then. That's excellent. And then we can assume by July 1st, if you make it to the 50,000, between that number of vaccines administered and the number of people who have actually contracted the virus, that we may begin to possibly experience a bit of herd immunity. Would that be accurate?
Yeah, we hope we will experience some sort of herd immunity, and really the sign that we've reached that is our new cases per day, which would be considered our caseload, and when our caseload really decreases. And so for St. Croix, you'll see in our epi report that we've been putting up, we're still having a significant number of new cases every day. St. Thomas has slowed down a little bit, but a couple weeks ago, they also were having a significant number of new cases every day. So our last report that we put out, we had reported 6 new cases in a single day. What's really important on that report to look at is the 7-day percent positivity. It was at 2.6% towards the end of last week, and we really want it to stay under 5. We currently have 89 active cases in the territory, and just remember, every single one of those 89 cases we check on every day to see how are you doing, and offer monoclonal antibody treatment if they qualify. Some of those might end up needing hospitalization. A lot of those are in quarantine, non-congregate quarantine facilities, so they would need food and medicine delivered. So it is a significant amount of work to work with every single active case within the territory.
That is a tremendous amount of work. And looking at the vaccines again, so we have Moderna and Pfizer, and now we're hearing that Johnson and Johnson has been approved.
Yeah.
And I have heard that some people here in the territory are very interested in receiving that. When do you think that vaccine will be available here, or is it already?
So we do have it available here. We just received it, and we're continuing to order it. So every week we'll get more on island. And right now, the goal is to utilize that vaccine for those that it's harder to get a second dose to. So we're going to be utilizing that vaccine for our starting with our homeless population, and then moving to others. Let's see, I wrote down where we're starting. So we're starting with the homeless population. We're starting with seniors who cannot need to receive the vaccine in their own home. And then we'll be moving to hospitalized patients that are being discharged.
Okay, excellent, excellent. So, what do the individual providers have the Johnson and Johnson vaccine available, or is that only through the Department of Health?
Not yet. So it's only available right now through the Department of Health.
Okay. Okay. Every once in a while, I look at our comments and so forth here, and we do have one person who says that she's diabetic and would be interested about the monoclonal antibody treatment, but that's only if she has actually contracted the virus, right?
Right. So only if you get COVID. Definitely, if you're diabetic, you would qualify. And so at the time that you become positive, you will be offered that treatment and definitely should consider taking the treatment to prevent severe disease.
Okay, good to know. Good to know. And so now, once people receive the vaccine, let's say they've received Pfizer or Moderna, both doses. What is the CDC saying now about the precautions that they should still exercise and the activities they can engage in? Where are we now with that?
Well, great news for those that have been vaccinated. There are less restrictions. So let me pull up that. Okay, so fully vaccinated people, and so that's if you're getting the Pfizer vaccine or the Moderna vaccine, that's 2 weeks after you've gotten the second dose of your vaccine, can visit with other fully vaccinated people indoors without wearing masks or staying 6 feet apart. And of course, outdoors, but indoors we know is at more risk. So you can visit with other fully vaccinated people now without wearing a mask or socially distanced. You can also visit with unvaccinated people from one other household indoors at a time without wearing masks or staying 6 feet apart if everyone in the other household is at low risk for severe disease. And then the third one, and this one actually was really kind of the most important one for me because you can refrain from quarantine and testing if you've had contact with a confirmed case, but you don't have symptoms. And so, since epidemiology does a lot of the testing and contact tracing, but we always have so many people that are quarantined simply because they were a close contact of a positive. And they a lot of times never become positive, but they still have to quarantine because they could become positive. And sometimes people with COVID don't have any symptoms at all and can still spread it to others. So if you've been vaccinated and you have contact with a confirmed case, you do not have to quarantine as long as you're not sick. If you do get sick, then you would need to get tested and potentially quarantine.
Okay, so let me ask this question then, and this is a real living question I have right now. So I have a friend
Mhm.
who is COVID-19 positive presently and is in isolation, in quarantine at home.
Mhm.
Uh, like, can I take food to that person? I have received both vaccines already, by the way. Um, do I have to leave food outside the door or can I go inside? And what about to wash this person's clothing, let's say? Can I take that clothing and wash it or like how should I help or how can I help?
Yeah. Well, you would definitely be the safest person to help that person. And so, yeah, you can drop off food, you could wash clothing. I would, since you know they're positive, this is more like if you came into contact with someone and then they tested positive and you didn't know, but you know that person's positive, I would still take precautions as far as wearing a mask. But if you wear a mask and goggles or a face shield while you're within 6 feet of that person, you're 100% protected. I mean, we test people within epidemiology every day that are positive, and we've never contracted a single case within our staff because of the PPE. So if you're wearing PPE, you can definitely even visit with that person. But I would just be cautious because there's still that 5% chance as a vaccinated or fully vaccinated individual that you could get sick. And so it's since you know that person's positive, it's not worth the risk, but you definitely could take them food, wash clothing, etc.
Okay, great. That's good to know because I was wondering how could I show up for this person and not become ill myself. But like I said, thankfully I received both doses. So and by the way, I understand now that here in the Virgin Islands, I think as of maybe 2 weeks ago, approximately, the vaccination is open to everybody, regardless of age or pre-existing medical condition, et cetera. Right?
right? So anyone 16 and over can get the vaccine, and that was as of March 1st. And it was really wonderful seeing a lot of our high school juniors and seniors coming into the community vaccination centers doing their part. Everyone that gets the vaccine, it's not just protecting you, it's also a service to your community, because you're protecting those that can't get the vaccine. So those under 16 can't get the vaccine. Also, there are some people with very severe allergies specifically to vaccines that have had anaphylactic shock, reactions to prior vaccines. They are not recommended to get this vaccine. But that's in rare cases would we not recommend the vaccine due to allergies, because we've had some questions like, I'm allergic to shellfish, really allergic, or I'm allergic to eggs, or whatever it is. So it's fine if you have food allergies or other allergies to get the vaccine. It's only if you've had a severe reaction to a vaccine that you would definitely want to work with your healthcare provider to determine if it's safe for you.
Okay, and we're running very low on time, but just one other question. You said anybody over the age of 16, and I've heard that said on national news and so forth. But why aren't people under the age of 16 allowed to receive the vaccine?
So it's simply because of the way the clinical trials were designed. It hasn't been tested. So right now there's clinical trials that have been going on for over 6 months that are testing the vaccine in 12 to 16-year-olds. And then we just started some clinical trials in I think it's 8 to 12. So once those trials are done and it's approved for use in the younger populations, then it will be able to be used here. You cannot participate in those trials in the Virgin Islands. We weren't included in the trials, probably due to our small population size, but there are trials currently going on to ensure that it's safe in that population. And then if it opens up to the younger population, we'll let everybody know.
Fantastic, fantastic. So, how can the public learn more about how the Department of Health is managing this crisis and how to receive the vaccines? Is there a website the Department of Health has?
Yeah, definitely. So the one I really wanted to highlight is because I know there's only one phone number to schedule a vaccine. I'll go ahead and say it in case you do want to try to call it. It's 340-777-8227. But you can also schedule your own appointment, either from your phone, internet, or computer internet by going to covid19usvi.com/vaccines. And you just click on a link and you say, I want to get the vaccine tomorrow at the CDC or whatever it is. You pick your time. It's from 8 to 7 now p.m. in 30-minute slots. And yesterday, we actually just opened up the ability to make vaccine appointments on St. John. So you can also schedule an appointment, and on St. John, it'll be every Saturday from 8 to noon for the next 6 Saturdays.
Fantastic. Well, we're right out of time. Dr. Ellis, thank you so much for being with us today and giving us so much insightful information. And thank you for all the great work you do here in the Virgin Islands.
Thank you so much. Thank you.
Have a great day.
Okay.